Radio Al-Ansar and the Al-Ansar Foundation.
Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al-Ansar will be held responsible for any ill health caused by the advice given on Radio Al-Ansar.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على رسوله الكريم سيدنا محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. All praise due to Allah, the Lord, cherisher, nourisher, sustainer and master of the universe, the most gracious, the most beneficent, the most merciful. Ya Allah, it is only you that we worship and it is your guidance that we seek. Ya Allah, keep us on the straight path. Ya Allah, shower us with your choice of blessings. Ya Allah, shower us with your mercy. Ya Allah, guide us. Greetings, salam, salutations on our beloved Nabi Muhammadur Rasulullah sallallahu alaihi wasallam. It's now time for Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. Assalamu alaikum wa rahmatullahi wa barakatuh. And we welcome our listeners on Radio Al-Ansar, CII Radio, Voice of the Cape, Radio 786, Sirius FM, Radio Islam and IFM Port Elizabeth, and all listening to us on audio streaming and other social platforms. Our topic for discussion is diagnosis and management of stroke, and our guest this evening is Dr. HOOSAIN PARUK, a neurologist in private practice practicing in Pietermaritzburg. Dr. HOOSAIN PARUK, assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah khair for joining me in the program this evening.
Wa alaikum assalam wa rahmatullahi wa barakatuh. It is a pleasure to be on the show.
Now, I know, Dr. Paruk, you've been on our show several times, but I think let's start the discussion. I introduced you as a neurologist. Very, very briefly, what does a neurologist do?
So, neurologist deals with conditions regarding the nervous system. So, the nervous system entails the brain, spinal cord, nerve, all the way to the muscle. Mm-hmm. So, anywhere along the line is a problem that potentially may be treated by a neurologist.
Jazakallah khair for that. Now, as our topic for discussion is the management, diagnosis, etc. of stroke, let's start by discussing what is a stroke.
So very simply, a stroke is an interruption of the blood supply to the brain. Mm-hmm. And this is essentially going to lead to a disruption of the supply of oxygen and vital nutrients to the brain cells.
And how long can the brain cells survive without, without a blood supply?
A short time. So in fact, the brain cells are very sensitive to deprivation of oxygen, and they can actually die permanently within a few minutes, for example, 5 minutes.
So no supply of brain for 5 minutes can be fatal?
Well, will lead to those brain cells being irreversibly damaged.
Okay. So there can be numerous repercussions of this, consequences.
Yeah. Fortunately, we do have backup mechanisms which will help to maintain blood supply to the areas of the brain. So there's not only one, for example, when you're going to a certain place, there's not one road there. Mm-hmm. There's several smaller roads. So there's usually a few different smaller blood vessels that can maintain blood supply. So it just depends on exact mechanism, way of the interruption of the blood supply that will determine how quickly and how many brain cells will actually die and whether it's going to be reversible or irreversible.
Now, having said that, what is the mechanism by which the blood supply gets interrupted?
So the analogy to understand this is to think of our water supply at home.
Okay.
We have pipes that are coming from the reservoir that come to our homes. So initially they're via large pipes, and then as they come to our home, those pipes become progressively smaller. Mm-hmm. So in the human body, we have the heart, which is the pump, which has blood vessels leading out of it, the aorta, which is a large vessel. Mm-hmm. And then this vessel will then branch into smaller vessels, which eventually will supply the brain. Now, what can happen to those water pipes at home? Either they can get clogged, so the water can't flow through. In the case of the brain, in the body, these vessels can be obstructed with what we call a clot. So there's no blood flow going in to the target tissue. Or the other thing that can happen to our water pipes at home is they can leak. They can have a burst pipe.
Okay.
So these blood vessels in our body sometimes can also be subjected to certain types of injury where they will actually rupture and there will be a leakage of blood from these vessels and thereby cause damage to the brain tissue. So the first type of stroke where we have the clot, an obstruction, the failure of blood to flow through is what we call an ischemic stroke.
Okay.
It is the more common type of stroke. Probably in the region of 80 to 85% of strokes are what we call ischemic strokes. And the second type where we have a rupture of a vessel and leakage of blood is what we call a hemorrhagic stroke. And that probably accounts for the balance of the strokes, between 15 to 20% of strokes.
Yeah. But having said that, how common is the stroke?
So strokes are fairly common. It's estimated that in South Africa, there's between 75 to 150,000 new cases of stroke per year.
Frightening.
Yeah. So just to put it into perspectives, some estimates are saying we're having a good few strokes every hour. So whilst we're on the show, there are going to be across the country a few people experiencing a stroke.
And does the stroke, does it affect all age groups?
Yes, stroke can affect children as well, but it is more common to affect the older population. Having said that, in South Africa, we do have a lot of hypertension prevalent among the younger population. So compared to countries internationally, we do have younger people affected by stroke simply because we have a greater number of younger individuals being afflicted by hypertension.
So I think I'm going to just digress. Having said that, you mentioned hypertension. I take it as one of the causes of strokes. What are the general causes of strokes then?
So the main risk factors for stroke are hypertension, diabetes, cholesterol, having conditions of the heart that impair blood flow or predispose one to forming clots. So for example, something called atrial fibrillation, people who have valvular heart disease, then people who have conditions of the body systemically that make the blood more likely to clot, what we call a hypercoagulable state. Other causes include things such as drug abuse. Then there are certain genetic causes. There are causes where there's inflammation of blood vessels. This can be on an immune basis and secondary to certain infections. So there's a wide variety of causes. But the most common category of cause that we're going to see is atherosclerosis. And the main primary driver for this, the most important single risk factor for stroke is hypertension, that is elevated blood pressures.
Just remind our listeners that this is an interactive program. We are discussing stroke, causes, diagnosis, management, etc. And our guest this evening is Dr. HOOSAIN PARUK, a neurologist who's in private practice in Johannesburg. If you have any questions for Dr. PARUK, forward them to us via WhatsApp on 060 904 1056. I repeat, 060 904 1056. Now, Dr. PARUK, is stroke a major cause of disability?
Yes, most certainly. So remember, of all of these people who are experiencing stroke, a minority will actually, probably in the region of around 10%, will recover to full or normal function.
Okay.
So if we combined the years lived with disability, it's estimated to be approximately 95,000 on an annual basis, 95,000 lived years of disability in South Africa.
I'm a bit confused. When you say 95,000 lived years.
Yeah, so if you look at all of the people and the amount of time that they're spending with disability.
Okay, with the number of people. Yeah. Okay. And is there, let's talk prevention. Because I'm already startled at the statistics that you're sharing with us, some of the causes. How can one prevent a stroke, or can one prevent a stroke?
Yes, in most instances, stroke is actually a preventable disease in view of the risk factors, which are actually diseases of lifestyle and can be preventable. Not in every instance, but in the majority of instances. So I would say it's important to have an active lifestyle, avoid being sedentary, a healthy diet, the Mediterranean sort of lifestyle of more fresh fish and vegetables is what's encouraged. avoiding too much of stress, anxiety, not smoking, not consuming alcohol or drugs. These are very simple measures, but quite implementable in our daily lives.
So stress, anxiety, etc., can induce a stroke.
Well, together with other risk factors, they're more likely to result in elevated blood pressures and probably have some role as well in chronic inflammation within the body, which also has a role in the development of stroke.
060-904-1056. You may forward to us your questions via WhatsApp. Our discussion is on strokes, and our guest is Dr. HOOSAIN PARUK, a neurologist in private practice in Pietermaritzburg. Now, Dr. Paruk, can a person die from a stroke?
Yes. So we mentioned earlier that with after between 75,000 to 150,000 patients who might be having individuals who might be having a stroke, it's estimated that there's approximately 25,000 people a year who die from a stroke in South Africa.
Really, these statistics are really worrying.
Yes. So stroke is amongst the top 2 or 3 leading causes of death in South Africa, and it's probably the main cause of disability in South Africa.
So, having said all of this, I'm sure all of our listeners are also concerned. How does one recognize a stroke?
So one needs to look out for the major symptoms of a stroke. And this relates to the brain function. So typically, it would result in weakness or numbness on one side of the body.
Okay.
We must understand that the brain is divided into two, the right and left side. And the right side of the brain controls the left and vice versa. So looking out for weakness or numbness on one side of the body, looking out for slurred speech, looking out for difficulty with vision, these are the major signs of a stroke. And what we advocate is the acronym FAST, where F stands for the face. So we ask the person to smile and see if this face is drooping on one side. A is for arm. Can the person hold up the arm straight, or does it droop downwards? One arm. S is to listen to the person's speech, and is it slurred? And T is stands for time, to make a note of the time at which the symptoms have started, and to recognize that it's time to call for medical assistance.
Now, something that you mentioned when we started the program was that the blood can do without, the brain can do without blood, without flow of blood for about 5 minutes max. Now, how does that impact on if somebody's getting a stroke? Do you have like 5 minutes to sort something out?
Well, that's the time in which we start getting you will start losing brain cells. And we can lose up to 1.9 million brain cells per minute. So time is of essence. And in stroke, the term is time is brain. So therefore, when one sees somebody having these symptoms, it's very important to try to get them to a medical facility as quickly as possible for assistance, because there is still a time window in which possibly there is some treatment that may help to restore the blood supply to the brain and salvage the brain tissue and minimize the amount of damage and therefore the amount of residual, deficit that will be left with the patient.
Are generally doctors equipped to deal with the situation, general practitioners, etc., or are all hospitals equipped to deal with this, or you have specialized hospitals that deal with this type of situations? And the reason I ask is that if someone's getting a stroke, one needs to know where to go to.
Right. So generally, if one is recognizing a stroke, it's preferable, I would say, that to go to a hospital directly. So in very simple terms, everybody understands what a heart attack is, which is it's a disruption of blood supply to the heart muscle. A stroke is a brain attack. So one should not go to one's GP first and then go to the doctor, to the hospital. One should actually go straight to the hospital. Now, there is an effort to get the paramedics on board with recognizing a stroke and prioritizing the ambulance dispatch to calls for a possible stroke and taking these patients directly to the hospitals so that they can get urgent intervention. So stroke systems are require a wide range of services to be on board. And internationally, the operator is trained to recognize the symptoms of a stroke and to activate what we call the stroke pathway.
Okay.
So that from the time that the call is placed, that this could be a possible stroke, is given urgent attention.
There's two questions come through. The first is, can doctor explain the differences between stroke and hypoxia, brain injury, and recovery?
So stroke is referring to the specific circumstance where we're having interruption of blood supply. Hypoxia means lack of oxygen, which can occur, for example, let's say in drowning, when a person hasn't been breathing well. So there is still brain blood supply, but blood that is deoxygenated is flowing through. So in a hypoxic injury, the damage to the brain can be quite diffuse because the whole brain is going to be affected. Whereas in a stroke, we're looking at a particular blood vessel is going to be interrupted, so a certain region of the brain will be affected.
Next question that comes to is, my top reading is always high, 164/77. It was my last reading. I'm 66 years old. I have hypertension and diabetes, both controlled at the moment. So what can you enlighten me on this? I think it's more relating to hypertension as cause of stroke.
Yeah, so a normal blood pressure is 120/80. But every individual is different. And I mean, I think in your situation, a doctor who has a history of what your blood pressure recordings are and what treatment you're on would be able to better advise you as to whether you need to adjust your medication and to what degree.
I think we've dealt with this next question that's come through. The question is, why is time important? I think we have dealt with it.
Yes, but just to reiterate, it's because with time, the more the brain cells are exposed to this lack of blood supply, more brain cells are going to die, and greater is going to be the damage and deficit that the person will experience.
Now, doctor, if symptoms subside before medical help arrives, does that mean that one can safely ignore the episode and relax?
No. So in fact, in that situation, one is fortunate, right, that one had a transient interruption of the blood supply, but due to the body's own restorative mechanisms, the blood supply is restored and patient recovers and does not have any symptoms. So that is what we refer to as a transient ischemic attack.
Okay.
In other words, a warning stroke.
So I take it it doesn't take too long. So
the symptoms may last a few minutes, sometimes an hour.
Up to an hour?
Can be, yeah. So it's a moot point as to where we should draw the definition. Previously, it used to be said 24 hours. But the thing is that we should treat it as a stroke because it's a warning stroke. And once one has one of these episodes, one is at increased risk of having a repeat episode. And one can't be certain as to which episode is then going to be irreversible. So having a warning stroke in a way is almost good fortune because it gives one the opportunity to seek medical help and then perhaps have those risk factors attended to prevent a major stroke. So
even if your symptoms have subsided, you inverted commas back to normal, you still go and seek medical attention.
One should still seek medical attention.
I think that's absolutely important. And is it possible to establish which part or side of the brain is affected?
Yes, so I mentioned earlier that the right side of the brain controls the left side of the body. So if a stroke is affecting the right side of the brain, it will be the left arm and leg and left side of the face that is generally affected. So depending on also how the body is affected, whether it's the arm more than the leg more than the arm, sometimes it may not necessarily be weakness, but just incoordination. A doctor would also examine to see what kind of affectation there is of the eye movements. One can then sort of try to place or localize the stroke to a certain area of the brain and lateralize which side of the brain the stroke is taking place.
060-904-1056. We are discussing strokes, and we are discussing strokes. Our guest this evening is Dr. HOOSAIN PARUK, a neurologist. But doctor, another question came in. Are there any stroke-ready hospitals in Durban for immediate medical attention?
So there are a good few hospitals now that are able to institute what we call thrombolysis. Most of the hospitals should have a protocol in place, and the major hospitals, yes, will definitely be able to activate what we refer to as a stroke pathway.
So if one is, experienced a stroke, he should be rushed to the nearest hospital, and that's the safest, because we assume that these hospitals can deal with it.
Yes, but probably the larger hospitals that have a full-time casualty service and the scanning facilities available will probably be more suitable.
060-904-1056. We look forward to your questions. Yes, we've got I think it's time for an ad break. We'll take a break. We'll continue on the other side of this. Do stay with us.
Teaching you something new every day. Radio Al Ansar.
This hadith is sponsored by Ashraful Aid, International Humanitarian Organization.
حديث أدي قال رسول الله صلى الله عليه وسلم أحسن خلقك للناس. Treat others with the best of manners. Treat others in the way you would like to be treated. Do not be harsh and rude. Be kind to all. Allah subhanahu wa ta'ala loves those who have good manners.
This hadith is sponsored by Ashraful Aid, International Humanitarian Organization.
Are you looking for a meaningful way to fulfill your zakat obligation? Look no further than Ashraful Aid. With our trusted track record, your zakat reaches those who need it the most in the most honorable and dignified manner. Visit our website at www.ashrafulaid.org.
Sunnah a Day, proudly brought to you by Sunpick, 100% pure sunflower cooking oil. Sunpick, cook more with less.
Sunnah a day, never blow into a glass or any vessel used for drinking.
Sunnah a Day, proudly brought to you by Sunpick, 100% pure sunflower cooking oil. Sunpick, cook more with less.
Imagine this. You're putting together a 7-color meal, from the creamy pasta to the glazed carrots and flavorful onion gravy. This entire meal is made with our 100% pure extra virgin olive oil from our La Familia range, bringing outstanding quality and taste to your kitchen. Shop La Familia 100% pure extra virgin olive oil at any leading supermarkets near you. La Familia, heart of the home.
Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
You're listening to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. Our topic for discussion is the diagnosis and diagnosis, causes and management of stroke. And our special guest this evening is Dr. HOOSAIN PARUK, a neurologist in private practice in Pietermaritzburg. Dr. PARUK, a question that comes from one of the listeners is, my brother was 38 when he died from an aneurysm. Can doctor explain what an aneurysm is, please?
So an aneurysm is a weak point on a blood vessel that dilates or has an outpouching, sort of like it would look like a pimple on the blood vessel or the artery. And it is at that weak point at which it would rupture and there would be leakage of blood. Usually it causes what we refer to as a subarachnoid bleed. There's a certain space on the surface of the brain that it would leak into. And it is also a type of stroke. Unfortunately, it can be quite severe, and a good proportion of patients, up to a third of patients, will actually die with a subarachnoid hemorrhage before they even reach the hospital.
Okay. And That's also one of causes of strokes, am I correct? When you said earlier ruptured vessels.
Yeah, so that's one mechanism by which a stroke occurs. Aneurysms can be due to genetic factors and then also trauma, hypertension as well.
060-904-1056. You're welcome to forward towards your questions on strokes to doctor via WhatsApp 060-904-1056. Now, doctor, how does a doctor differentiate between the two mechanisms of stroke?
So there might be certain clues in terms of how rapid the symptoms are, whether the person has a headache, whether there's loss of consciousness at the onset, that may tell a doctor whether this is an ischemic stroke or hemorrhagic stroke. But in fact, it's not 100% reliable. And even neurologist specialists will often err in differentiating between a hemorrhagic and ischemic stroke.
Mm-hmm.
So the step that is actually required is to do a scan to confirm whether it's an ischemic or hemorrhagic stroke.
Now, doctor, are there any conditions that can be mistaken for a stroke?
Yes. So a person who has very low blood sugar is probably the most important mimic for a stroke. So it's essential that all patients have at least a finger prick glucose done, especially if they are known diabetic and are using insulin or oral hypoglycemic medications. And then sometimes a person can have epilepsy or can experience a seizure, and following the seizure, one side of the body can be weak. This can be a mimic for a stroke. And then less commonly, there can be other conditions where persons, due to various causes, which sort of result in comatose-like conditions, sometimes even psychological conditions, can actually look like a stroke.
Okay. So if one's getting a panic attack, one can mistake that for a stroke?
It can happen sometimes.
Okay. A question that comes through is a question that I think we've always been asked. I mean, you might have been asked privately as well, that we are told that if somebody's getting a stroke, prick their finger and let them bleed, it will ease the stroke.
Yeah, so there's no medical evidence that or physiological rationale in which that would help, because we're looking at blood supply to the brain. Whilst we're just talking about the mimics of the stroke, the other one that comes to mind is a person who has what we refer to as a Bell's palsy, which is just paralysis of the muscles on one side of the face, which is actually due to a nerve problem.
Mm-hmm.
And the question for that one, Faizal, is often whether they should cut a pigeon and use the blood on the face.
Yes. And in fact, that seems to be a practice amongst the community.
There's some anecdotal evidence for it, but I can't tell you that there's any medical or scientific evidence for it.
Lots of these things do help, but of course, if it will assist, well and good. Doctor, we did mention that where I asked you what are the causes of it, and you did mention hypertension, etc., as one of the major causes. Are there any other causes or risk factors that one should look out for?
Yeah, so the increased blood sugar, diabetes, cholesterol, cigarette smoking, alcohol consumption, sedentary lifestyle, diseases of the heart. So those are the other major risk factors.
060-904-1056. We are discussing strokes, and any questions for Dr. HOOSAIN PARUK, please forward them to us via WhatsApp 060-904-1056. Doc, is hypertension related to ischemic or hemorrhagic stroke?
It's important for both types of stroke.
And the treatment of ischemic stroke, what does this treatment entail?
So we were mentioning earlier that it's important to get through to a medical facility as quickly as possible. So the first step is to establish or confirm the diagnosis of a stroke. As I said, it's very difficult to be certain, 100% certain, just by examining the patient, and in other words, on clinical grounds alone, to differentiate between a hemorrhagic or ischemic stroke. So the next step is to do a scan. Usually it's quicker to get a CT scan as opposed to an MRI scan. MRI scans are more accurate and give more information, but in a very early stage, the aim is to try to differentiate between an ischemic stroke and a hemorrhagic stroke. So a CT scan will show up blood very quickly and can tell you if the person has had a bleed or not.
Okay.
If there's no bleed and the scan appears normal, but the person has signs of a stroke, then it can still be taken that this person has got an ischemic stroke.
Okay.
Now, remember we said the idea is to restore the blood supply as quickly as possible. So, on the premise that there is a blood clot that is interrupting the blood supply, we use medications, what we refer to as thrombolytic medication, which attempt to break down the clot. In other words, lyse the clot. This medication is effective if administered as soon as possible after the onset of the symptoms, but up to 4.5 hours. In most instances, you have up to 4.5 hours to administer this medication. Thereafter, less and less people will benefit. Now, although one has up to 4.5, it will be much more effective if administered, for example, within the first 90 minutes.
Okay.
So that's the first tool that's available with regards to restoration of blood flow, is to use a medication that will break the clot. Mm-hmm. And this drug came into vogue was the initial studies that found him to be effective was in the 90s. In the past decade or so after about 2010, 2015, around that region, what has become in vogue now is to actually go and remove the clot. So it was found that the medication that breaks the clots works for small clots, but not for larger clots which are obstructing the larger vessels of the brain. So for the larger vessels of the brain, it's more effective to actually physically remove the clot by what we refer to as mechanical thrombectomy. So in this procedure, a catheter is inserted through the artery or the vessel in the groin, passed all the way up through to the vessel in the brain, and the clot is actually removed. So that's referred to as a thrombectomy, because it's removing the thrombus or the clot, or an embolectomy, an embolus. And this procedure has actually got a longer time window than our thrombolytic drugs. So whereas we need to administer thrombolytic drugs in the first 4.5 hours, initially when this procedure became available, it was found that it could be effective in individuals up to 6 hours from the time of onset. And then subsequently to that, it's been found that in selected individuals, there's up to 24-hour time window to actually go and remove this clot and help relieve the symptoms.
But when you remove this clot, does it? Can I say that the stroke has been treated, or it eases things?
So what we will be doing is we'll be restoring blood flow, and so it comes back to our original discussion where we were mentioning how sensitive brain cells are to deprivation of blood supply. So if a person has got what I mentioned earlier about good collaterals, other smaller blood vessels supplying some amount of blood, so the tissue may have been at risk but not completely damaged, right? If those collaterals were still supporting that brain tissue and we then able to open up, so to say, the main highway again and get a good blood flow going, then there'll be minimal damage left over. But if there wasn't very good collateral supply supporting those instances in the first place, then it might be too late. One may salvage some of the tissue, but there may still be some deficit. So it's not necessarily the patient is going to be at 100% recovery, but one may improve the outcome.
Another question comes through from one of the listeners. Would it be correct to say that government public hospitals are not equipped or do not treat strokes with thrombolytics, and not all private hospitals have a stroke unit to treat strokes by thrombolysis? Hospitals with a stroke unit should be made known publicly so that a family do not rush a stroke patient to a private hospital that does not specialize in stroke treatment. Would you comment on that, doctor?
Yes, so I think in public hospitals, there is a challenge. I have worked in a public hospital, in a central hospital in Durban, where we did have a stroke protocol, but I mean, we were a specialist hospital. But I would say yes, probably most instances, by the time an ambulance even gets a patient to the hospital, it's probably going to be too late. So in most instances, people going to public hospitals won't receive the same level of care. And again, there's going to be a disproportion between urban areas and rural areas where they don't even have any scanning facilities available. And then with regards to the private hospitals, so those hospitals that are becoming sort of stroke ready, so to say, are marketing or advertising themselves and going on public education drives to inform the public that they do have that they are stroke ready or can cater for an acute stroke patient.
But I think generally hospitals are bracing themselves for this situation.
Yes, it is something that is going to become more common. I don't want to on air now start mentioning hospitals, because if I miss out a hospital, then I'll be in trouble.
Yes, definitely. Okay, I'm not going to comment on the marketing side of it. But Doc, it's time for us to take another ad break. And yes, we'll visit the marketplace. We'll continue after this, inshallah.
Teaching you something new every day. Radio Al Ansar.
This segment is brought to you by Kenfield Auto, your RMI approved service and repair specialist. 236 Brickfield Road, Overport. Kenfield Auto.
Bismillahirrahmanirrahim. ربنا إنك من تدخل النار فقد أخزيته وما للظالمين من أنصار.
Car won't start?
Kenfield Auto.
Noisy brakes?
Kenfield Auto.
Due for a service?
Kenfield Auto. Kenfield Auto, the answer to all your car problems. Your service and repair specialist for your VW, Audi, Suzuki, Toyota, or just about any vehicle. Kenfield Auto, your RMI and insurance approved workshop to handle them all. 236 Brickfield Road, Overport. Call us on 031 207 2399. Kenfield Auto.
Color your world with Color Trade Paints. Color Trade Paints, stockers of interior and exterior coatings. We got you covered with our wide range of roof colors and are stockers of industrial floor coatings. A Color Trade innovation, the 4-in-1 primer must always be your first choice. Magic Cover PVA, 99 Rand per 5 liters. Peach, cream or white. Restore your driveway with high durability jet black tar coat, 690 Rands per 20 liters. Get to a Color Trade Paint store near you or visit our e-store. Call 086 126 8888 for free delivery. Make the right paint choice. Always ensure color before trade. Buy Color Trade Paints.
At Checkstar, get Oro Squash 2 liter, take 2 for 70 Rand. Or Lay's Chips, take 3 for 55 Rand. Offers valid until 9th November 2025. Only at Checkstar, Mount Edgecombe, Durban CBD and Sparks Road branches. T's and C's apply.
Radio Al Ansar, 24/7. 365.
Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Listen to medical files on the I brought to you by the Islamic Medical Association of South Africa, hosted by myself, Faizal Suleman, and we are broadcasting on radio stations, several radio stations at Radio Al Ansar, CI Radio, Voice of the Cape, Radio 786, Sirius FM, Radio Islam, and IFM Port Elizabeth, as well as on different audio streaming platforms as well. Our topic for discussion is the diagnosis and management of stroke, and our guest this evening is Dr. HOOSAIN PARUK, a neurologist in private practice in Pietermaritzburg. Now, Dr. PARUK, we were discussing prior to the ad break whether there are any hospitals with a stroke unit, and if there is, it should be made known publicly, etc. But I think you want to comment on that.
Yes, just for the people who are concerned about which hospital to go to. So, I mean, so for example, let's just take we just our program we're having it here in Durban. So there would be certain hospitals here in Durban, but I think people who've got the vascular risk factors and are concerned about this, wherever you are, because I mean we've been heard in a wide variety of places throughout the country, need to have this discussion with their doctor, with their specialist, that should any complication like this arise, which would be a suitable hospital to go to. And I think that would alleviate a lot of the anxiety.
We had the WhatsApp from my brother Mac, and he sent us, a YouTube video, but obviously we don't have time to see it. He wanted to know if the above technique is available in the country. Unfortunately, Doc can't open this particular YouTube thing right now, so we won't be able to respond to that. Then there's a message from my brother Yasin which says, Assalamu alaikum. I watched my mother-in-law not get any proper treatment to help her during her stroke, from paramedics to the private hospital. It was sad that it seemed like they either were not equipped or not prepared more effectively and efficient for stroke cases. And Brother Yasin, it's really sad, and we really sympathize with you here. But your thoughts, Dr. HOOSAIN PARUK?
Yes, so stroke is something that we need to obviously educate public as well as health professionals. I'm not here to defend anybody, but it is something that we still need to sort of create awareness both amongst health professionals as well as the public to try and improve healthcare. But this emergency treatment of stroke is just one aspect of the stroke, and as we'll discuss later, that there's more to treating the stroke as well than just this very urgent care.
In fact, can we discuss that at this stage, Doc, if you don't mind, the treatment, if you don't mind, because time's against us.
Okay, so we just discussed what we refer to as the acute treatment of stroke that's trying to break the clot down. Now, we have to accept that not everybody is going to present in a time window. Even in a country like in the Western world where they've got all of the resources, the minority of patients actually get thrombolized. So the vast majority of patients are actually not going to get that early stroke treatment. And that brings us to what we refer to as a stroke unit. Now, a stroke unit, very simply put, is a geographically defined area within the hospital where care is dedicated and tailored towards stroke patients. And it's not just a doctor who's going to be part of this stroke unit, right? So we have a stroke team. So yes, there will be doctors, not just neurologists. There will be other physicians as well. There will be a neurosurgeon. There will be also nurses. There will be dietitians, speech therapists, physiotherapists, occupational therapists, because there's a whole range of needs that the patient with a stroke has, and it requires these people of multiple disciplines to actually come together to provide the optimal care for these patients.
So I think this is one of the conditions, one of the few conditions that need so many disciplines present.
Well, a lot in medicine is shifting towards what we refer to as multidisciplinary care, but it works particularly well when it comes to stroke care.
Thank you for that, Doctor. Earlier on, we discussed the treatment of ischemic stroke. What does that entail? What about the hemorrhagic stroke?
So the hemorrhagic stroke is where there's a bleeding, and I just mentioned why sometimes we need a neurosurgeon. Now, again, the most important thing to controlling the bleeding is to control the blood pressure. So think of a pipe that's burst. If it's under high pressure, more blood's going to leak. If you control the pressure, less blood will leak. So the idea, what we're recognizing now when it comes to hemorrhagic strokes, is to, as quickly as possible, bring the blood pressure down, because these patients often have very elevated blood pressures. This is a little bit different to the ischemic stroke, where blood pressures are also often elevated, but it's very often also now part of a reflex mechanism of the body to push more blood to the area of the brain that has been deprived of blood supply. So in those situations, we don't want to drop the blood pressure down too rapidly. But in a hemorrhagic stroke, we do want to control the blood pressure, not to very low levels, but to just a normalish level or slightly above normal level. We typically aim for a target of around 140/90. And depending on the location of the bleed and the size of the bleed, there might be a role for surgery, where a surgeon can actually evacuate the blood, which forms what we refer to as a hematoma, which will then relieve the pressure. and help to improve outcome in these patients.
And what are the complications of the stroke? Of a stroke, it presents with quite a few complications.
Yes. So the initial symptoms, obviously, manifestations is the weakness, the numbness, paralysis on one side of the body, incoordination, etc. But as a result of this, for example, let's say a person's got weakness of the muscles responsible for swallowing, and if we attempt to feed this patient too quickly, they will actually aspirate. In other words, the food particles will go into the airways in the lungs, and this will result in an aspiration pneumonia.
Mm-hmm.
If a person's lying in bed, cannot move, they may develop stasis of the blood in the legs, which will form a clot, and it results in what we call a deep venous thrombosis.
Mm-hmm.
That can then, a piece of that can break off, go to the lungs, result in what we refer to as a pulmonary embolism.
Mm-hmm.
A limb that's not moving at all and fixed in an abnormal position can result in a contracture. A person who's too weak or off balance, tries to walk too quickly, can fall, injure themselves. So these are some of the complications that need very practical things that we need to anticipate and prevent before they occur. And this is where we come back to the stroke unit and the multidisciplinary team.
Mm-hmm.
So a speech therapist will assess a patient and see if it's safe for them to swallow. A physiotherapist will administer the proper techniques to try and prevent contractures and assist with mobilization, safe mobilization. So that's where the stroke unit is particularly helpful, is to anticipate and prevent these complications. And these are not very expensive measures.
Okay.
They are very simple, straightforward measures.
Mm-hmm. Mm-hmm.
To check the temperature and make sure the patient's not developing a temperature.
Mm-hmm.
To check the blood sugar and make sure that it's well controlled. To monitor the blood pressure. This doesn't require state-of-the-art, highly advanced medicine. This is something that even the public hospitals can do.
Okay.
To turn a patient to prevent bed sores is basic nursing care.
Mm-hmm.
So all these things can take place in a stroke unit. And I think what is required is that for this a stroke protocol to just be formalized in all of these hospitals. And when one does, when the effect of a stroke unit has been analyzed, and its effect is probably as good overall, not in improving the number of in improving outcome as compared to giving thrombolytic therapy. For example, when they found that I mentioned in the 90s when they discovered these medications that break the clots.
Mm-hmm.
So it was found that those who received the medication, approximately 34-35% will have a good outcome.
Okay.
But at the end of 3 months.
Okay.
At the same time, those who didn't receive the medication but just received the same type of care in a stroke unit, 20-22% will also have a good outcome.
Okay.
Right. So it showed that just receiving this package of care also helps to improve outcome. So one shouldn't be despondent if one missed out on the early therapy. There's still a lot that can be done and can be achieved.
We've got like 2 minutes left for the show, but there's 2 questions that's very important that's coming. The first question is, are there any risks with blood thinners?
Yes. So firstly, there's different types. When you talk of blood thinning medication, depending on the cause of the stroke, we would use either antiplatelet agents or we use anticoagulants. After a TIA, transient ischemic attack, or a minor stroke, we use blood thinners for a period of 3 weeks, and thereafter we switch to just using one, as it's been found that the long-term use of 2 blood thinners will actually increase the risk of bleeding. And then secondly, when we use anticoagulant medications, for example, an old drug, warfarin, it has drug interactions with other medications, can be affected by the foods that you eat, and sometimes it might make the blood sort of what we refer to as overly thin, and one then at risk of bleeding, particularly if one falls. One needs to have constant monitoring and so on. There are newer alternatives that are available, more expensive. These are referred to as the novel or direct oral anticoagulants. They're much more expensive, but they don't require the monthly monitoring, and they're much more straightforward to use, don't have as much interactions. But again, they will also have a similar bleeding risk. Whenever taking medication, it's weighing up the risk-benefit ratio. So that's where a discussion with your doctor is helpful to determine what is the risk of having a recurrent stroke versus the risk of having a catastrophic bleed in order to make a decision.
Dr. PARUK, I think 30 seconds, ask if you can handle the next question, the psychological consequences after stroke.
Anxiety, depression, adjustment, these are all significant factors that can take place after a stroke. People can't return to their previous level of functioning. So it's something that, again, that needs to be looked out for and managed.
Dr. PARUK, Jazakallah khair for joining the program this evening. We've got quite a few questions coming. Some brothers are mentioning some hospitals that provide this facility. Another brother has mentioned about the how cupping has assisted in other conditions, can assist in strokes as well. But unfortunately, time doesn't permit. I want to thank you once again for joining me in the program on Medical Files, and I want to thank the engineers for having engineered this evening on all the different stations. And I want to thank the listeners for tuning into Medical Files. Medical Files will be back with you next Tuesday evening at 8 p.m. inshallah. So till then, for myself, Faizal MJ Suleman, have a wonderful week, and Assalamu alaikum wa rahmatullahi wa barakatuh.
وحسن الربيع وماء المطر مقامهم فوق رأس الجبال وفوق الروابي وعند
Doctors and guests on a Medical Files program. Any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors